All right, Big Man. Today is Tuesday. It's Wednesday, excuse me. It is June 22nd. Welcome to the Dog Walk presented by Barstool Sports. Hey, before we get going, if you're watching on YouTube, which if you are, please subscribe. We got these awesome new shirts that are in stock here. These look sick on 4th of July. Look at that. Eddie's Ice Cream Shop. You see the Chipwich. You know I love the Chipwich. I'm wearing the one that's got a green mint chocolate chip scoop. And the most beautiful one of all, check out this back one. We got the Bomb Pop, the Firecracker, whatever they call it where you're from. Go buy one. Check one out. Real cool summer shirts. It's honestly the Firecracker one, the Bomb Pop one is probably one of the shirts that get complimented most on. So go grab it if you are so kind to, or if you have the extra couple bucks to do so. All right, we can hop in the interview. In studio, we are back in the old studio. Dog Walk is back here. I am joined by a guest, Dr. Justin Dubin, who is a sex doctor.
That's correct. Male infertility, sexual medicine. I'm a urologist, currently here at Northwestern, completing my fellowship. I'm moving back to Hollywood, Florida, where I'll be the director of men's health over down there. So
Nice,
I'll be
man.
living in Miami.
Nice. Long road, huh? Long road for
Yeah,
those
we were just
doctors.
talking. It's been a long road. I'm 34, finally getting my first real job. You know, I've been over 10 years of training. It's kind of crazy.
It is crazy. So I caught you at the KFC radio meet and greet, and that's where you told me you're a sex doctor, and you're like, yeah, I'm leaving in 2 weeks. I was like, I need you to come
Yeah.
to the office before you leave, so thank you for making time to
Dude, thanks
do
for
this.
having me come in. This has been awesome. I'm a big Barstool fan. I was telling these guys outside the office, since 2010, I worked in an office for 2 years in the Upper East Side. So like I was there because I was listening to KFC all those years ago, you know, before they had the office in New York. And you guys are just doing amazing things. And then when I moved here, I started really listening to you guys. And you guys are awesome. You get the pulse of the people in Chicago, man, better than anyone else I've listened to. And it's just been really awesome to be here, and thanks for having me.
Thanks, man. I appreciate that.
Yeah,
and I
for
think
sure.
our audience is going to find this interesting. A lot of good stuff we're going to get into today.
I think so. There's a lot of fun stuff.
There is, yeah. Just looking through your Instagram and stuff you specialize in, I got like 8 topics here that we're going to get deep into. Balls deep, someone
Balls
said. How
deep,
about
yeah, that's
that?
perfect.
That's a bad joke, but we're here. All right, man. So let's start with, there's so many ways we could start. Let's start with erectile dysfunction. How about that?
Perfect. Let's talk about that.
Okay.
So what do you want to know? Anything specific?
So pretty common, right?
Very, very common. So about 30% of men under the age of 40 have erectile dysfunction, and then it goes 40% of men in their 40s, 50% of men in their 50s, 60% of men in their 60s, and about 70% of men in their 70s. It's the most common sexual dysfunction issue that men have. So, you know, it's one of these things where I think most guys and girls think that erectile dysfunction or how erections work is like black or white. You get it up or you don't get it up. But, you know, we don't give ourselves enough credit. Erectile dysfunction and to get an erection is actually pretty complicated. So you actually need 5 things to get a good erection, okay? 1, you need good blood flow, right? Your erection is literally blood flowing to your penis. So if you got bad blood flow, you're not getting a good erection. And, you know, actually, you know, if you get your you know, vessels are clogged or stuff like that, you're not getting a good erection. So you see erectile dysfunction as actually known to be one of the first signs of coronary artery disease, so heart disease. So if if you're overweight, you're having erectile dysfunction issues, you have a family history of heart problems, maybe this might be the canary in the coal mine for you. So that's one thing. 2, you need good nerves. You know, nerves, you know, connect your central nervous system, your brain to your penis. And, you know, if you have diabetes or if you have trauma issues, you know, that can be compromised. People think diabetes, they think, you know, eye problems, they can't feel their feet, they can't feel their hands, but, you know, your penis is in there too. You know, one of the most common reasons why guys come with us with ED is because they have diabetes.
Really?
Yeah. And then, you know, 3 is you need good hormones. So testosterone specifically. So testosterone's a big one. You have low testosterone, you may get erectile dysfunction. 4 is you need to be aroused. That one kind of makes sense, right? You're not just walking around with a Woody. I mean, someone, there's ways you can, but I'm not going to tell you how to do that. But, and then the last one is actually kind of surprising. And I think this one taps into a lot of the younger guys. You need to be in a good state of mind. If you're stressed, you got fear, you got anxiety, you know, you're not going to get it up. You're just not. But also the problem comes twofold with that. Because if you're depressed, and you're actually taking medication, sometimes the side effect of these medications can also cause erectile dysfunction. And But it is like a testament to, the mind being more powerful than anything else, right? I think it was Robin Williams. He said, during his stand-up all those years ago, God gave man a brain and a penis and only enough blood to control one at a time. So yeah, that's kind of where we're at with erectile dysfunction.
Okay, so now does grower or shower matter at all?
So grower versus shower doesn't really matter, but we have defined grower versus shower.
Okay.
So there was a paper that came out a couple years ago that if your penis goes from flaccid or soft to erect and it increases in size by more than 1.5 inches, you're a grower. And then if it doesn't, you're a shower. But I don't think it really matters. But if you're interested, when you're home, go ahead and see if you're a grower versus a shower. But I don't think it really matters. There's a lot of guys I've seen, we give people erections sometimes in the office. They are very clear growers and some are showers. But I think it's, it's not a big deal either way.
No.
What do you think the average size penis is?
I feel like I've seen this on a podcast before. I want to say it's somewhere around 4, right? 4.
Soft or hard?
Oh, well, that depends because what's the percentage of growers versus showers? Do you know that?
I don't know the percentage. I'm not sure. I could look it up at some point, but.
Oh, bro.
But just say average erect penis. That's a great question. I never thought about that. Like what percentage of the growers are increased in that average?
Yeah, for sure. So erect penis, I'm going to say 4.25 is the average maybe.
5.1 to 5.5 inches.
Oh, okay. 5.1 to 5. Okay.
Yeah, it's not
That makes
bad.
sense. For some reason, I didn't want us to go 5s because I felt like that was like the normal answer.
Yeah, no, it's fair. Or you didn't want to go too big just because, you didn't want to show off yourself.
Yeah, there you go.
That was it.
That was my.
But
that was my goal.
so the average penis is like 5.1, 5.5. A lot of stuff is really funny that they've done, big socks, big dick. Doesn't work. Big shoes. They've done studies. They've looked at like 15,000 guys. They measured their foot size. They measured their penis. No correlation.
No correlation at all.
So no, you got these giant basketball players, these athletes.
Crazy though. If you're rocking those fucking 16s, I just figure you got a hammer.
I would assume so too, man. But maybe like they didn't measure those. Like those are in general are outliers, right? Like so maybe. I hope for their sake they're not rocking like a 5.1.
Yeah, exactly, because it's just not proportional for sure.
Yeah.
Now, wait, what did you say the third one was? I know the first one you said was coronary artery.
I said blood flow, then we got nerves, then we said testosterone.
Now, okay, do you recommend T-shots then?
That's a good question. So about 20% of men above the age of 30 have low testosterone. Mm-hmm. Now, low testosterone we define as a testosterone level less than 300. However, to have the way we define testosterone deficiency, you have to be symptomatic. Like, you could be walking around and that's fine. So, symptomatic means, you have low energy, you have erectile dysfunction, you have focus issues, depression, motivation decreases, you're losing facial hair or body hair. These are signs and symptoms of testosterone deficiency. And if you do or you're worried about it, go talk to your urologist. I recommend staying away from these men's health clinics that you see pop up all over the country. I've seen them here in Chicago. You bet your ass I saw them in Miami when I was down there, and I'm going back down there. And the thing is with testosterone is great to treat men who have low T, but the thing that they don't talk about is it can cause infertility in men.
Really?
So if you're above a certain age, testosterone's great and you don't want to have kids anymore, that's fine. But if you come in to me, you come in, you say, hey, I want to have kids, I got low testosterone, we'll do a workup, and I see you have low testosterone, I'm not going to give you a testosterone shot if you want to have kids. I'm going to probably give you another medication. We have medications like Clomid, which is a way to naturally increase. It's an oral pill that naturally increases your testosterone levels by yourself. And it it preserves your fertility. And some guys who have low fertility actually that helps their fertility as well. So I think testosterone is good for the right person, but that's why I think it's important that, and I appreciate you coming on because I think a lot of guys don't know this. Like this is the most important thing. Like I see guys in clinic all the time. They come in, they're having problems with their partner. and they're like, we've been trying for a year and a half, 2 years, and we just can't have a kid. And then I look at their sperm because they tell me they're on testosterone and they got no sperm in their ejaculate. The good news is it's usually reversible. When you stop testosterone, it takes about 3 months for new sperm to generate. But, if you're in a time crunch and stuff like that, people want to have a kid when they want to have a kid.
Yeah.
And the other thing, there's no guarantees. Some people don't get better.
Yeah.
So it's important you talk with your doctor and you understand these kinds of risks. And don't just go to these men's health clinics that, I don't know, God knows who's there. Sometimes they just, here's $5,000, give me $5,000, here's or $1,000, take the testosterone, and we'll see you every month as long as you pay.
Yeah. That probably happens a lot.
Yeah, it does.
Damn, dude. So, but then what's the, so that's the main downside with taking a T-shot.
Yeah.
Would be that. And then also, I think a lot of dudes are afraid because they think that will accelerate hair loss.
So yeah, we do ask about hair loss. We ask about acne as well. Like you can develop like some acne, but
because what is you essentially almost hit a puberty stage again, or
no, it's just. I mean, when you think about you're right. And it's just increased testosterone is just associated with dermatological issues, kind of just like puberty. Exactly. That's why you get acne during puberty because your testosterone levels skyrocket.
Yeah, and then obviously if you're taking anabolic steroids. Like people who have back knee and shit, it's because you're just on massive amounts of testosterone. Exactly. And there is when you're taking testosterone, people are like, I just need to go to 3,000. And I'm like, dude, you don't the goal is to get us to a level of 400 to 600. I said the lower level is 300. We want to get you up to about 400 and 600 to 600. And you should feel pretty damn good with yourself. Damn. Okay. I feel like a lot of people, that's something should be looked into.
Oh yeah.
And what's the test to find out?
It's a blood work. It's blood work. It's we usually ask you to get an AM testosterone level. We usually, if you're low one time, we get you to do it twice. But your testosterone levels, there's a circadian rhythm. So in the morning, it's at its highest. So we want to get a blood level when early in the morning before 10 a.m. Just to see where you're at.
Okay. Hey, real quick here, Kenny Chesney is in concert this weekend. He is at Soldier Field on Saturday. So if you're listening here and you're in the Chicagoland area, go check out Kenny Chesney and use the Game Time app. Or listen, wherever you're at across the United States, you're going to be able to get concert tickets this weekend. I mean, a summer concert, you can't beat it. Make sure you're mixing Game Time in here because it's an exclusive ticketing partner at Barstool Sports, and it makes it easy to score last-minute deals with tickets to sporting events, concerts, and shows, and they guarantee the lowest price. They crack the code on how to score last-minute tickets, and the biggest last-minute price drops can be found on the seats you thought you could never buy. I've used it. It's super easy. I'm going to use it again, definitely at some point very soon, whether it be for a concert or a Cubs game. So whether you're spontaneously buying tickets to the concerts you've been eyeing or planning ahead for the NFL season, Game Time is the best ticketing app, making your live event experience seamless and affordable. The best part is you get $20 off your first purchase. Download the Game Time app. Go to the account tab to create a login. Redeem code DOGWALK for $20 off your first purchase. Terms do apply. Download Game Time. Last minute tickets. Lowest price guaranteed. Go do it. All right, so that's pretty much covering erectile dysfunction.
Yeah.
And T-shots. Is there anything else?
Well, I think when we're talking about medications for erectile dysfunction, I think is a big one. And I think the most common two are Viagra and Cialis.
Yeah.
And more I'm seeing younger guys take it. I don't think that's a problem. Erectile dysfunction, way more younger guys are coming in, and whether it's because of increased stress in life, it's pretty controversial. A lot of people are like, why the hell are all these guys under 30 coming in and their dick's not working? Mm-hmm. But some people point towards porn. Some people point towards mental health issues, and mental health has a big issue right now. A lot of people, were struggling during COVID. Papers showed more people were on antidepressants. More people were also using Cialis and Viagra than ever. Does that mean just more people were having sex, or does it mean that they needed it? So we don't know, but both drugs are pretty awesome and they're pretty safe for young guys. So I think they're good medications if you have these issues. And a lot of guys, when it comes to stress, when they're younger, they come in, they're you have a bad event one time. You're with a girl, Everyone's been there. You just can't get it up one time. And it kind of gets you stuck in this loop. You freak out about it. You get nervous. And guys will come see me and they're like, can I just get a Viagra or a Cialis? And, we'll give it to them. And often they don't come back because, you just need one go to kind of rock your partner's world. And then you're kind of feeling back into it. But using these meds, it's pretty good. I mean, Viagra lasts about 6 to 8 hours. So you can take it about 2 hours before you want to use it on an empty stomach usually. So if you're going out on a date on a Friday night at like 7, you could take it around 6, have the dinner, drinks, go back to her place, or your place.
Good to go.
You're good to go. Cialis is like, lasts a little bit longer. It can last 24 to 36 hours. So I personally, for the younger guys, I like to give them Cialis just because of the fact that it lasts longer and you can have more spontaneity. So like you can take it Friday morning and you're good to go. Friday night, you're good to go. You don't have to worry about, do I need to take it? Like, when do I need to take it? And you can take it with or without food. So a lot of guys take Cialis dailies because it stays in your system for that long. And it actually, after about 5 days, you have like a baseline that you're kind of always good to go. So I mean, it's just a preference, but we can cater to the issues that you need. And that's why it's important for guys with these issues to come talk with us about it, because we can treat these things. Everything we've talked about, I got a treatment for you if you just want to come in and see it. When was the last, I was talking to these guys, they hadn't been a doctor in like 10 years. Like literally, I think Dave, Chief, they're like 2012. I was just interested because I think that that's one of the reasons why I want to come on, because guys only go to the doctor if they're dying, and they're only going to the emergency room.
Yeah, and what's crazy too is you hear, like, you'll talk to, a friend's girlfriend's friend, and they'll be like, oh, like, why'd you break up with this guy? It's like, oh, well, like, he had erection issues, his dick just never worked, and it's like, well, he probably, like, you hear that so often, and it's like, people just don't know there's ways to get it fixed, I guess. And especially now, I wonder if are you saying Cialis and Viagra are just those name brands?
Those are name brands. Tadalafil is Cialis, sorry. Like if you go buy on any online website, direct to consumer, it's Tadalafil and Sildenafil. Those are the actual names. Sildenafil is Viagra, Tadalafil is Cialis.
Yeah, because obviously we personally are sponsored by Roman,
right?
And those companies, I wonder if the numbers are up because those are more prevalent among our fan bases who are listening to this show and using our promo code and whatnot. I wonder if is that why? Like, are those numbers factor in? Do you think that's possible?
I think that those services for those medications have done a great service for a lot of guys because the problem is the stigma of coming to see a doctor. Like the way I see it is like guys don't want to come in because they see it as some sort of like weakness. It's like, oh man, I can't get my dick up. I don't want to talk to anyone, but I can order something online that's going to help me get it. And I don't have to worry about it, right? It's so easy.
So easy.
But if it helps, it helps, right? But like, I just told you 5 ways your dick may not work. What if we just, instead of just covering it up with a Band-Aid, maybe we can figure out what the hell is actually going wrong.
Yeah.
Sometimes it's nothing, right? Sometimes it's absolutely nothing and you just need a good go, or you like how you feel like you perform better, and that's great.
Now, is that okay though?
What do you mean?
Because now, say if you're not someone who struggles with ED, but you're like, hey, I just kind of feel like I'm going on vacation. I'm trying to put on a good performance.
Honestly,
today.
I'm okay. I'm okay with that. If it puts you in a right state of mind, right?
Okay.
Like if you like are nervous, or you're like, I want a big, like you come up to me and you say like, Doc, I'm a little nervous. I'm going on my honeymoon.
Yeah.
Going to be drinking. I've had ED in the past with this. I just kind of want to make sure, everything's individual, right?
Like some doctors would say no, probably. But
I don't know. I think that it really depends on the situation. I can't say 100% of the time I'm going to say, sure, let's do it. I'm not going to say like, but and that's why it's important to come talk to me, because I can't say, I'm just going to give it to you just to go have a fun time and party. I don't want you to do that, right? Medicine's medicine. There's still side effects. There's still risks. Like for this one, it's very low risk, but there's things like, headaches, flushing, runny nose. But if you mix them with like cocaine or like other hard recreational drugs. Because one of those are really bad
with cocaine, right?
You're at increased risk for something called a priapism, which like if you're doing them with other drugs, like some of these drugs alone, like Molly and and cocaine can give you a priapism by itself. So
Yeah.
like if you're taking it with, he's like, I don't want you to do that. And if you tell me, I'm not going to give you the medication.
What's a priapism?
Priapism is when your erection lasts longer than 4 hours.
Ah, okay.
So, but the important thing about the Cialis and the Viagra is like, it's not like in the movies where you take it and then you're just rock hard walking around. You got to be aroused. You got to be stimulated. It just enhances the flow when you're aroused. There's other things like injections to your penis that it bypasses your brain and it just makes you hard. But for guys probably listening to this in this age group, that's probably not going to be the intervention that we would offer.
Okay. All right.
Like usually we would give you the oral stuff first.
Okay. And then also if people are listening, there's drilling going on in the building. I don't know if you guys could hear it or not. Apologize, but that's what that is. You're not going crazy in your car or with your AirPods in. Damn, man. So, okay. Because I know that I always heard that there was a big thing, like one of them you couldn't drink on, one you couldn't do coke on. And I just say that because I don't know what people are into, because I know that is a factor that people be like, oh, I don't want to take it because I don't want to mix them, which is smart. Or if they don't know that, they should know shit you can't mix because it could be catastrophic.
Agree. And alcohol's fine.
On both of those drugs.
For both, yeah. Okay. You're fine. I mean, that goes to something though, like whiskey dick. You just have enough drinks, and you're not going to work because how whiskey dick works is basically, it decreases some blood flow to your penis. Your nerves are not firing the way that they need to, and you're probably going to have an issue getting it up. But we all know that sometimes it also gets you out of that anxiety. It kind of relaxes you a little bit. So there's a fine line, right? It can in moderation, it could potentially help you get an erection if you're a little nervous, right? Common date, you go out, have a couple drinks, go back to someone's place, So there's
a whiskey dick, obviously, it's a thing. It's a big real detriment to getting an erection.
Yeah, I would say so. And I do want to bring up what you mentioned before, which I think is a really important point, when you talked about girls complaining about guys and having erections. And when I was in Miami, we were looking at I heard a lot of women saying that exact thing. And a lot of the women, though, because I'm a urologist, they were telling me that like their partner, the male partner, was blaming them for loss of their erection. And I heard it enough that we did a project. I surveyed 13,000 women. And what we found out was about 80% of the time, 80% of these women had experienced having sex with a guy at least once who had erectile dysfunction. So it's common. So the first thing for guys to know is this happens, right? Like, so you shouldn't freak out. But the thing that got worrisome is that we found out 1 in 7 men blamed their female partner for 1 in 7 of these women had experienced their male partner blaming them for erectile dysfunction. And what that was associated with was decreased sexual, less sexual engagement, decreased sexual pleasure by the partner. The woman had increased worry. And the most important thing, she was more willing to end the relationship because of their erectile dysfunction. So like, what's important for guys here is you got to learn, I just told you a lot of things. There's a lot of things that can happen in that moment. But the one thing you can't do is you can't lose your shit and blame it on someone else. And maybe there are situations, right? Like when I posted the results of that study, a lot of guys reached out to me and said, "Hey, you know what? You're right, but girls have also laughed at me and stuff like that." So it does go through both ways.
But doesn't it fall into the point 4, where it's like loss of attraction?
Well, yeah, there is aspects to that, but sometimes maybe you got whiskey dick and then you're like blaming it on someone, or maybe it's a first date and or your first time going at it and you can't get it up and you're like freaking the fuck out, So like it's so situational that it's important, like communicating. Yeah. And a lot of girls have said like, the hottest thing I've seen is like a guy couldn't get up. He didn't really care. He kind of laughed it off, said like, not today. And then you go do other stuff. Penetrative sex is not the only kind. You got oral, use your hands. Like there's a lot of fun things you can keep doing.
Yeah. Well, yeah, it's crazy though, man, because every situation is just so different. Like you don't know if she's willing to do this. And that's why there's a lot of things there's a lot of factors.
Oh, I agree. I'm not, listen,
yeah.
I totally agree. But, it's just one of those things. I think we guys don't communicate sometimes to our partners enough, and guys don't communicate to their doctors or see them enough. So, like, I think a big theme here is, like, just talking to someone, right? Yeah. Like, I feel like you just got to talk to them. And so yeah, that's kind of where I'm at with that part for sure.
What did you find with porn? Because the
Yeah.
old adage as well was that if guys are jerking off too much, you're eventually not going to be able to get it up either.
Yeah, so porn is a very controversial thing right now, like with regards to its role in erectile dysfunction. I think, there are a lot of people who probably overuse porn, and that can obviously cause some issues. What's the movie with Joseph Gordon-Levitt?
Oh yeah, Don John.
Don John.
Good movie.
Like that's a good movie. That's a good movie. So obviously that's like a situation where using too much porn, not an ideal situation.
Yeah.
And the thing is with pornography, you can kind of get into like your kink or your niche, and sometimes you can't recreate that in real life. And that's obviously you're kind of overstimulating yourself to that one thing. And so, if you talk to sex therapists, one of the big things they tell you is you got to diversify your porn. So
really?
like you diversify your portfolio in the market, you want to diversify your portfolio when it comes to porn, maybe a little ass here, a little this, like whatever. So you don't just like streamline to the same thing. Maybe you're going out and there's something about one girl that attracts you or so, I don't know, so I mean, porn can do these things, right? Porn can cause potentially erectile dysfunction, but also it could be a really great tool to use. Sex therapists use it. It's a great tool for partners to kind of get each other going off. So I think porn's a great thing. I'm a big fan. I mean, that sounds weird, but yeah. I think, guys being dudes, that's kind of what it is.
You're a big fan of, okay. Diversifying your porn, dude. See, like, honestly, like you say, like, oh, it's like it honestly makes sense, because if you're only getting off to the crazy, like, that's just not a reality.
You're never going to do that in real life.
Yeah, exactly. It's just not happen.
You're just not. And that kind of goes to the next thing we looked at, porn stars. We did research on porn stars, because a lot of the guys, and it kind of goes to the porn issue here, is that we're coming in. When I was in Miami, I did my training at University of Miami, and when we were there, a lot of guys were coming in with erectile dysfunction. Some of them were complaining about porn. They're like, I'm trying to perform like these porn stars. And being in Miami, we also saw porn stars in our office, and they were complaining of the same erectile dysfunction that all these other guys. Mm-hmm. So, I was like, why don't we just look at porn stars and see if they have the same problems as everyone else, right? I mean, they are performing sex way more than everyone else. So let's see what happens. So we surveyed male porn stars. We also surveyed female porn stars, but I'll tell you the male stuff first. We found out, and you can't even make this up, 69% of them were using like Viagra or Cialis to perform during porn. And this is young guys. Most of the guys mostly using it were under the age of 30. So, and about 40% of these porn stars had erectile dysfunction. And you just heard the numbers. That's pretty much like everyone else.
That sounds low.
You thought it would be higher.
I thought it'd be higher, dude. Because here's the thing. And also, do they have erectile dysfunction, or are they being asked to do something that's like completely over the bounds of what normal sex is?
That is 100% the point. Like, I don't think, like, first off, so 40% of them, most of them under the age of 40, had erectile dysfunction. And it makes sense, exactly what you said. Like, I agree. Like, it's hard enough for a normal dude just to have sex, sometimes get it up. These guys are having sex like multiple times a day for prolonged periods of time. And then you got them zooming in, 5 people watching them, zooming in on their dick. Yeah. Like, how are you going to get that up? It's amazing that 40%. You're right. Yeah. But I think the point is really, like, you can't compare yourself to these guys, right? Like, first off, they're corking the bat. Mm-hmm. You know that already. Mm-hmm. And then second off, like, they got the problem just as much as everyone else. So like, it's not a fair comparison. You're putting too much pressure on yourself. Yeah. So, that's kind of what we got from that.
Interesting. And then the women side.
The women, so we surveyed them, and there's something called female sexual dysfunction. About 40% in general population have it. It's a combination of things. Women are much more complicated in terms of sexual function, sexual dysfunction than guys are. We're point and shoot guys, right? That's what we're point and shoot. Yeah. There's a lot of stuff. So female sexual dysfunction includes things like lack of desire, pain during intercourse, lack of arousal, lack of orgasm. And so we surveyed these women, and it was only about 24% of them were at risk for female sexual dysfunction. I said about 40% of women in the United States. And it kind of made sense, though, because the average female porn star is what, like 18, 19 probably. the average age of the people in our survey was about 34. So the turnover we know in this stuff is very, very high. So the people who obviously were stuck around were probably not enjoying it.
Yeah.
So I think it's self-selected out in the older population.
Man, it's just, that's so different. Like, that guys, it's like fucking pin the tail on the donkey. For women, it's like an erector set or mousetrap, It's just such a process.
It's completely different. It's the survey, you need a physical exam. It's very, very complicated.
Now, I wonder if the rise of OnlyFans is going to help that. Because obviously there are a lot of Instagram models and, very attractive women who use that platform, but also there's more normal people who are using it too, everyday people, to make it more kind of realistic and maybe diversifying your porn. I wonder how that's
we'll have to ask Lenny Balls. We'll have to ask Lenny Balls.
That's a great question. I'm going to write into OnlyStans this week. Go check out my guy.
Have him come. I'm happy to go on and talk to him about it.
Go check out my guy Glenn. But that was the first thing that jumped to my mind. What about premature ejaculation?
Yeah, so premature, once again, I'm going to ask you, how long do you think on average penetrative P and V sex lasts on average?
So I think I actually think that was in my ad read.
Oh, really?
Yeah, hold on.
No, I was listening to the episode coming in. I was listening to the draft this morning, and I think you said it like increased 3 times, but I don't know. You said like the average for the guys using your product was like 3.3 minutes.
Yeah. So maybe I'll say 2 minutes.
Average? I said before. I'll give you 3.3 minutes. You said before using your product.
Okay, before. Okay, yeah. I'll say. I don't know, bro. I'll say. I think 3.5 sounds
5.4.
Okay, so 5.4
minutes. Okay, that doesn't include like heavy petting. That doesn't include like other stuff. This is just pure intercourse, right? So like everything else can last longer, but it's actually a very common thing. About 30% of men claim to have premature ejaculation, but one of the keys we define premature ejaculation is it usually lasts less than 2 minutes, but it has to cause distress to you or your partner. So if you last less than 2 minutes, you're having a great time and your partner's having a great time, I'm not going to call that premature ejaculation.
Yeah.
Obviously, if you want to go longer, then I would consider that premature ejaculation.
Yeah, okay.
But yeah, it's actually pretty common, and there's 2 kinds, right? You can either be born with it. Some people have it. It's called, you just were born with it, or you can have acquired. And the acquired stuff can kind of go back to these mental health stuff, increased stress, relationship issues, erectile dysfunction. These things can cause premature ejaculation.
Now, would a T-shot help premature ejaculation or no?
I mean, I guess maybe.
Yeah.
I'm not. I guess if you have erectile dysfunction, it may help. But that's not the way I'm treating your premature ejaculation. The way I'm treating premature ejaculation, there's a couple ways. One, I think the least invasive ways is the product that you guys have. The swipes work. They are good products. They do help with premature ejaculation.
Nice. You're pro swipe.
I am pro swipe.
Cool.
I'm pro swipe.
There it is, folks. You've heard it. You heard it firsthand from a sex doctor. Roman swipes work. We're endorsed by Roman. Roman swipes are definitely the way to go. If you want longer lasting sex, go to getroman.com/dogwalk to get your first month of swipes for just $5 when you choose a monthly plan. Like he just said, he recommends them. So if you're trying to have longer sex, if you're trying to increase your time, hit that stopwatch. Let that stopwatch keep running. Roman swipes are the way to go. They're super easy to use as well. You take the swipe out. You apply it and let it dry for 5 minutes, and then you enjoy longer lasting sex. And it's uniquely formulated to reduce overstimulation without eliminating sensation altogether. And the more consistent you are with the swipes, the longer and better your sex will be. Go to getroman.com/dogwalk to get your first month of swipes for just $5 when you choose a monthly plan, like I said. It's great to have someone on here who could vouch for these swipes firsthand. So it was sweet to do that after talking about Roman for years at this point. So listen to him. Don't listen to me. But listen to me when you use the promo code. And that's getroman.com/dogwalk. Go do it.
I think also there's other things like you can take antidepressants. I mentioned that they cause erectile dysfunction potentially, but they can also cause in regular people delayed ejaculation. So a treatment for that for people with premature ejaculation is we give them very, very low dosage of antidepressants daily, and that can help. Sex therapy. They're the sex therapists we can send you to. They have some great, just tips of the trade, things that they can teach you how to do to delay your ejaculation. And often they tell you to teach those things by how? Watching porn. So like there's another way. Porn is good. It can help you. So those are kind of the most common ways to treat premature ejaculation, for sure. Yeah.
Okay. That's so it's good that there's help, because I think that's more, I guess it's harder to study. Like you said, it's more kind of subjective if you have it or not, because it's about if you view it as a problem or not, which is very interesting.
Correct.
Because I've heard before, totally different topic. I've heard before that a drinking problem is considered as if the people around you don't want to be around you and like don't think like your drinking is healthy. I could be wrong. Talk to a doctor about that, because there's
I would talk to, I don't
there's
know.
Definitely probably physical ways as that, but like one form of like finding a problem is if like people don't like literally don't want to be around
guilt, avoidance,
you. Yes.
and stuff like that is part of that. But
I
don't know. There's
probably more to that. Yeah.
But I mean, people telling you that you have a problem is probably a sign that you probably have a problem.
Yeah, maybe, but that's interesting that it kind of fits into that category where it's like, oh, it's up to them. If it's like a problem to them, then it is. If it's not, if everyone's happy, wipe your hands, go home. Like no.
Have a good time. You're still having sex. Congrats on the sex. You're still having sex.
Yeah,
that's cool.
Yeah. Congrats on this. Exactly. Man, all right. That's good. What about blue balls?
Okay, blue balls. Real or not real?
Real or not real? Yeah, I think it's real.
It's real.
Okay.
It's real.
I was going to say.
Blue balls is real. Yeah. Now, I feel like everyone listening, every guy's like, yeah, goddamn right, it's real. Like, smirking, but it's real. But so what it is the medical term is epididymal hypertension. So the epididymis is, you have your testicle that creates sperm, and the sperm then is sent into this little area, kind of is like a crescent shape, that is your epididymis. And that's where the sperm matures, and it travels and it gets maturity, and it gets modal. It can swim. So it can swim to wherever it needs to be, into a toilet paper, vagina, wherever it should go. So the epididymis is an important part of fertility and ejaculation. But what happens when you get aroused, obviously we talked about it. When you get an erection, you got blood flow to your penis, which causes the erection, but you also get increased blood flow to your balls. Now, if you're like, going at it for prolonged and you're aroused for a prolonged period of time and you don't orgasm, usually when you orgasm, your penis goes down, blood leaves your penis, blood leaves your balls, and you're good. But when you are having prolonged arousal, whether it's through intercourse or any kind of sexual activity, and your penis sometimes starts to go down if you're not orgasming, but there's still continued blood flow temporarily to your balls, and that increased blood flow causes swelling of your balls and some congestion of your balls. Hence, blue balls. It causes some pain and aching. So that's what blue balls is. Now, the good news is, blue balls doesn't do anything. It doesn't kill you. It doesn't cause cancer, despite whatever you may want to try to tell your female partner.
So there's zero repercussions.
There's zero repercussions other than you probably being sad and not feeling great. But the good news is, you can finish yourself. Or if your partner should not have any obligation is the point. Unfortunately, but the truth is they should not feel obligated. It's not going to cause their, if they don't want to engage anymore, that's okay. If they want to help you finish it, that's fine. If you want to do it, that's fine. Other things you can do, go take a shower. Just like distract yourself. Go, read a book or something. Watch TV. It gets better over time. But it's real.
So how is there like a length of time that it will eventually?
That's a good question. I have no idea.
You haven't seen that?
I don't know. I do not know.
Because I wonder if there's like there should be a hill that you made it out of to know that the blue balls are gone. Like, all right, the blood's gone. I could move on with my day. But
no, I don't have a window, unfortunately. The blue balls window. That's good. Maybe we can investigate.
And that's the next study. We need the blue balls window. When were you finally feeling okay to go outside and do something different and get your mind off? The blue balls. The blue balls study.
I like that.
I'd like to have my hand in that somehow.
Well, don't volunteer yet. Don't volunteer.
I don't want to be a participant. I'll just be in the facility.
Maybe we could get some interns or something.
Yeah, I'll begin a tour of the facility. Yeah, exactly. Exactly. Damn. Okay, so it's a real thing.
It's a real thing. It's a real thing. But that kind of, because we're on Barstool and because we're talking about blue balls, I think that one thing that I want to talk about is kind of related to blue balls is this thing called like semen retention. Have you heard of this?
No.
So this is really crazy. So I guess you can think about it as, athletes. Remember, you always hear, you always ask like these boxers, they don't have sex like a week before. They think it improves their performance and stuff like that, right? Like it's usually boxers, I feel. Yeah,
right? Fighters
and stuff like that. There's this idea of semen retention. It's kind of with that where, withholding your ejaculation, you can maybe orgasm as long as you don't ejaculate, improves your wellness, or your overall health and wellness. Like your skin gets better, your testosterone gets higher, your hair gets better. And it's a pretty old practice that was like, I think like at some point it was like a Kama Sutra thing, but over the last few years, it kind of just took off as this bullshit thing that like people think that if they just don't come, they're going to be better. And I didn't really hear about it for a while, but then I started going on TikTok because, everyone's on TikTok, and I started looking up men's health topics, and this kept coming up. So we just did a study, we're publishing it now, where we looked at the most common topics for men's health on TikTok and Instagram. And the number one was semen retention, with over 1 billion with a B views on TikTok, that's this topic, and 1 million posts on Instagram. And basically, all these guys are talking about how, like, it's really weird. It's like 18-year-old guys talking about how, like, their testosterone and their skin is better when they don't come. And the funny thing is, we talked about it. What happens when I give you testosterone? What happens when you go through puberty?
You want to come.
Well, you get acne too. You get acne. Everything they're saying literally makes no sense.
Yeah.
There's no data to support this stuff. And I think people are kind of like, I don't know how they're listening to this stuff, but it's kind of crazy. There's no data to support it. There was a couple research papers that were retracted. So, all this stuff doesn't make sense. And there's this other movement called NoFap, which is like anti-masturbation. It's very anti-porn. I'm sure people have heard about that one. NoFap, November.
No, not November.
No, not November. Yeah. But that it's similar in vein in terms of they're like, oh, porn's the devil, blah, blah, blah. And I think that those people are probably people who are addicted to porn at some point and kind of went the opposite direction. But there's no data for any of these things.
That?
There's no data. Like, listen, if you're addicted to something, you probably just don't do it anymore. But I think that, sometimes you just go the extreme opposite direction. But I do believe that, just going back to like, it's okay to come.
Yeah, I think
I think
that's the thing. Like I had a buddy who was like big into lifting and he was doing that. He's like, I'm not doing it for Lent or whatever. And I don't know, he was just convinced that it was just going to help his workouts and whatnot. And I don't know. So there's no backup on that.
There's no backup. I mean, maybe there's the placebo effect of like feeling like you're really focusing on yourself. But I mean, you're probably just jizzing in your sleep, some people you're gonna have a wet dream. Like a lot of these guys do have wet dreams when they just don't.
Oh, you have to be having it. Like it's got to be coming out one way or the other.
Right, exactly.
Like, no doubt about it.
And it's actually not good for your fertility.
That's what I was going to ask. Like, is there an opposite of that where it's not good to walk around with a loaded gun?
Yeah. So the believe it or not, I do male infertility as well, and I'll tell you this part first. The ideal amount, if you're trying to have a kid, you want to ejaculate like every day or every other day. So we recommend like every other day if you're trying to have a baby.
Ejaculate in your partner or like in just in general?
I mean, if you're trying to, in your partner, if you're trying to have a kid, your optimal semen parameters are when you ejaculate either daily or every other day. Because you're kind of cleaning the pipes. Kind of makes sense, right?
I know it sounds like a dumb question, but I didn't know if that was a thing where it's like you just want the pipes clean or like that's your best chance to get it in or,
Yeah, it's kind of both.
Flow.
It's kind of both. But, that kind of is one of these things where male fertility, no one talks about that.
Yeah.
And 15% of couples struggle with fertility. I mean, I'm 34. How old are you, Eddie?
31.
So, people our age having kids.
Yeah.
And I'm sure we've all dealt with or heard people struggling with these things, IVF, IUI, and stuff like that, in vitro fertilization, intrauterine insemination. And so 15% of couples struggle with fertility. 50% of the time, it's a female factor. believe it or not, it does take two people to have sex. 50% of the time, there's a male factor involved with couples who have fertility issues. 30% of the time, it's a strictly male issue with fertility.
So 50 women, 30 men?
Out of 100, it's 50 women,
okay.
30 men, but 50 of the guys also are involved in one way. There's like a crossover of some women, some men.
Okay, so okay.
So yeah, it's very common.
Now, are those numbers going up, or it's just we're older, so we realize them more, we know more people who are going through this?
That's very controversial. So there's a lot of papers. I read a book recently that, it's called The Countdown, that there are a couple epidemiologists who believe things like phthalates, which are like the plastics in our containers, in like foods that we eat, this processed stuff. There's a lot of beliefs that these things, cell phones potentially can decrease our semen parameters. Now, there was a meta-analysis, which is like a big paper of looking at all different papers that showed a downtrend in decreased semen parameters, sperm parameters in men. How accurate is it? It's kind of controversial. So I'm not sure. I think, there is a lot of compelling data out there that there's some very bad chemicals out there that, if you're not eating right or you're exposing yourself to certain things, that you can potentially harm your parameters. But is everyone's semen parameters going down? I think I don't want to be a person to scare someone. So I'm on the fence. I'm not really sure which way to go. But there are things like if you're trying to have a kid that you can prevent you can optimize yourself. Like obesity causes low testosterone. Low testosterone, you need testosterone to create sperm. So, losing weight, eating healthy, things like smoking weed. We're starting to find out smoking weed to some level, if you like moderation, probably okay. But if you want to really optimize it, you probably shouldn't smoke weed.
No shit.
Yeah. Smoking cigarettes can lower. I mean, now it's not as surprising. Testosterone, taking testosterone, we talked about, can cause infertility. One thing, exposure to a wet heat. So, you're in a jacuzzi, you're in a hot tub. Anything that increases your body temperature can potentially kill your sperm. And that kind of makes sense, right? Your balls are outside of your body because they need to be colder than the rest of your body. They need to be a couple degrees cooler for the sperm to be created. We don't really know why, but that's just the way it is. So if you go in a jacuzzi and you're like cooking these boys to higher than your body temperature, there could be repercussions. I mean, the good news is your sperm comes back every 3 months. It takes about 3 months for sperm to generate. And, saunas too. I have a couple of buddies who go in the sauna every day after the gym. That's totally cool. But if you're trying to have a kid, I go, probably don't do that.
Don't do that.
Don't do that.
Two extremes.
Yeah.
Now, okay. Wow. That was some interesting stuff right there.
Yeah, there's a lot of shit people don't know, but they don't want to know because they don't talk to. Listen, guys don't have primary care doctors. They don't come to see the men's health doctors like the urologists. And I'm just here to tell you, we get it. And we're trying to get you guys to come in because every single thing I've talked about we have issues that can be prevented, be treated. Mm-hmm. You just got to come in and talk about it.
What about the laptop myth, or is it a myth?
I'm not sure, but I don't usually sit with it on my balls. Okay, so I don't think it's probably an issue. I think this thing is not like
for
that
people
hot.
that don't know. Yeah, people say that your laptop would
increase the temperature.
Yeah. And then,
I don't know. I don't think it's like a big deal. I don't think it's going to give you cancer or anything.
What about Mountain Dew?
The Mountain Dew thing, I don't know, man. I love that. Was it number 7?
Yeah.
It's the color 7.
Was it that or was it the yellow 5?
The yellow 5. You're right. You're right. The yellow 5. I have no idea. Where'd that come from?
I mean, it's like a kid tease. It's like, oh, you're drinking yellow 5. You got no cum.
That's like the Marilyn Manson sucking his own.
Yeah,
That's exactly. Like one of those classic things that spread around before social media was social media.
Yeah, it's just fucking with your buddy. Yeah, that's what I think. That's what it was. That's what it started out with me. You just make fun of someone for no reason. You're fucking 5th grade talking about kids at that point. I mean, I'm a maniac. I had a varicocele surgery when I was in high school.
Oh, you had a varicocelectomy. Yeah, I had 2 varicocelectomies.
Did you?
Yeah.
No shit. So
did you have it for pain or
I don't know if it was somewhat bothering me. I forget exactly. I just I knew something was there. For people that don't know, it's pretty gross. They define it as, it's not gross, but the way they make it sounds gross.
Yes.
Because they call it a bag of worms.
Yes,
but
correct. It's the bag of worms sign.
Which is disgusting, but it's not gross at all. It's just like I felt like I had a little something extra in my sack. Yeah, exactly, because that's literally what I had. There was just a little more, a couple more M&Ms in the stocking, and I think, I don't know, it was just like my doctor was like, oh yeah, it's that. It's like you could keep it if you want, but it might lower your chances of having kids. And I don't know, me in like sophomore year of high school, I was like, yeah, I'll get it out.
Yeah, that's good. So for people who don't know, varicoceles are like varicose veins of your balls. It's pretty much what it is. Varicose veins of your legs. So your veins, they take blood and they return it from parts of your body to your heart. Arteries send them to organs, from your heart to your organs. Arteries have muscles, so they can contract and like transport out. Veins don't have like a muscle layer. They have kind of valves sometimes that make sure that there's no backflow. And varicose veins or varicoceles in your balls, for whatever reason, they're they can't effectively, you're kind of usually born with it, and they can't effectively return the flow back because these valves are now working, so you have dilation of your blood around that area, and your veins dilate, and it looks like a bag of worms surrounding your balls. And this issue is exactly what we talk about. It's very common. About, I think, like 15% of men have varicoceles and just live with it. But it can come in with fertility because of the things we talked about, right? So blood pooling around your testicle, blood can be warm. So it can, in theory, increase the temperature around your testicle, providing a less favorable environment for sperm to grow. So that's why we do the surgery. We tie off the veins. We make a cut. Did you have it up here? Or did they go through the laparoscopic?
They went through my waist.
Yeah. So, okay. So, and we tie off these veins so that the blood goes through other veins and your testicle is potentially not compromised. Now, does it cause infertility on everyone? No. We don't really, it's hard to predict who. Yeah. And the surgery itself overall does improve fertility. But sometimes, I would say the majority of the time it helps. Sometimes it doesn't help. Sometimes it can make it worse. So it's important you talk with your doctors about these things. But for the most part, it's a great surgery. I had it myself. I had it on both sides.
So you had a double-bagged worm?
I got double wormed.
Wow.
Double wormed.
Fucking trolley worms would be proud.
Dude, yeah, it was not a good look.
So now, did that also help our blood flow then? Getting that done, or like does that?
Not really. It's not. No, that's not going to matter. It's just going to help with
the temperature. Damn, dude, that's interesting shit. Like I didn't realize how it worked. I just knew, oh shit, there's something in there that might make it prohibit me from having kids. I didn't know it's like, oh yeah, that thing's going to cause some heat. And like we just talked about with saunas and shit.
Yeah, but it's not going to, like there's so many people out there live their whole lives with varicoceles and will never know, and it won't be an issue. Yeah. So it's just one of these things where the body is complicated as hell, and we don't have all the answers. And I can't predict until I look at a semen analysis of you who it has potentially compromised semen parameters because of a varicocele.
Now, can a dude, what's the process now if you did want to see like how the semen's looking? Like, is there an easier process?
There are.
Okay. How could people do that? Is it because you always hear from the girl's perspective, and I feel terrible for the women because it always feels like it's such a hard process.
Oh,
for them,
it is, dude.
It really does, and especially to try infertility and whatnot. So, how can men check if they're if they're swimming and everything's going well?
Yeah, well, great. The easiest way is go make an appointment with a urologist like me, and we can have you come in. We could get all your blood work. We look at like things like your testosterone level. And then we can write you a script for a semen analysis. Semen analysis, the standard way or the typical way would be like we'd put you in a room or you go to one of the labs and provide a sample, make sure you get it all in the cup. And then they do analysis. They look at your concentration, which is how much sperm you have, and the motility, which is can your boy swim? Those are the two most important numbers, right? Because if you don't got sperm, you're not getting anywhere. And if you got sperm, but they can't swim, they're never getting to the egg. So like those are the two important things. So that's the more standard way, but a lot of guys don't feel comfortable doing that, and I understand that. So now there is online, you can buy a lot of different things off of like Amazon. There's a lot of companies that you can just do a sample at home, and they can give you It's not going to be as accurate, first off, because we do it in a lab, but they can give you a general gestalt of like normal, low, go see a doctor, or like other and stuff. So there's ways you can go online, and there's good products that, you know, if you either don't have access to a doctor near you, or you don't want to go to the doctor yet, you want to just kind of screen yourself, I think it's a great option. And I think that we're going to start moving towards these things in the future. In the next 5-10 years, it's going to be really big, because there's not as many infertility male doctors as we would like there to be. And I think a lot of guys don't want to see them. So if we can at least have you test yourself so that you don't, you know, and you feel comfortable, or you know then that you really need to see me, then that's great, you know?
Yeah. No, so people would just type in like semen test online or something like that?
Yeah, there's at least like 5 or 6 different ones. And and I think you can, like, based off of how you want to do it and a cost budget, they're all pretty reasonable. I think most of them are within like $100 range.
Oh, okay. I would just do that just to check it out.
Yeah, I mean,
you know, I'm not
people
planning
do
having
that.
kids, but it's just, you know.
No, I've seen a lot of guys.
Interesting to know.
Yeah, we see a lot of guys who've come in, single guys who are like, I just wanted to know, and then it was low or something, and we can help them figure it out before it's time, because it takes people think like, you know, it's funny, when I talk with guys who come in the office, they're like, dude, you go your whole life and you're like, shit, I had sex once without a condom or birth control, I'm going to get someone pregnant. And sometimes it's not that easy. And, you know, like these guys come in and they're frustrated because they're like, we've been having sex like for the last year and nothing's happening. I went through school thinking this was going to be like a 5-second thing.
Now, does it turn on and off like that though?
What do you mean?
Like, you know, say you live your whole life, you live out your 20s, so to speak. And that's where you're like, oh, so worried about getting girls pregnant and whatnot. And then you find out in your 30s, like, oh, I never was able to do that anyways. Or like, you know, or is there times where it's like, oh, you do have swimmers, sometimes you do, sometimes you don't?
That's a great question. And the answer is we don't know. So really? we just did a project where we're trying to predict the paper. We presented our research at the recent conference. It's not published yet, but we tried to look at different hormone levels to see if we could predict someone progressively declining in semen parameters, and see if we can predict who's at risk for maybe having sperm when they're younger and then it going away when they're older. But we don't know. The answer is we don't know, because we only, you know, guys don't come in enough. And when we do see them, we only have this one window. So it's very possible they had some sperm, like great sperm parameters in the beginning, and they went away, or they just were the same the whole time. I don't know. And I could never tell anyone. But there are things, like I can tell you, like if you have cancer and you're getting chemotherapy or you're getting radiation, you need to go, before you get chemotherapy or radiation, to your doctor. You need to go talk with a male infertility doctor. You need to bank sperm. That is one of the most important things you can do, because there's no guarantees after you get chemotherapy or radiation that your sperm is going to come back.
Damn.
So that's like an important thing. Like there's things that I can tell you, life events, that are going to decrease your chances of ever having sperm back in your ejaculate, like that. But I can't just say in general, like, yeah, your sperm's declining. But sometimes, like these lifestyle things, maybe your sperm was bad for a while because you were unhealthy, you weren't taking care of yourself, you were like doing all these things you shouldn't be doing. And then you turn your life around, or you do a couple of lifestyle changes, and your sperm parameters are great. I literally saw a guy, and this has happened at least 5 times, especially in Chicago, you know, where weed's legal, which I'm fine with. I'm not anti-weed. I just, for this one thing, I think you just need to know. We've seen guys, they come in, they're like, I smoke weed every day, I go to the sauna, and they're in good shape, they're jacked, like, you know, go to the sauna after the gym every day, smoke a little weed, and I'm like, dude, you gotta just stop with the sauna and the weed. They had like no sperm in their ejaculate, they come back like 6 months later, completely normal.
Boom, turn back on.
So, you know, it's so individualized, but you got to talk to us, and we got to figure out how we can make this stuff work for you.
Now, how's the sperm bank process? Do you know much about that?
In terms of like what?
Like, is it pretty straightforward? Like, if you walk in and be like, hey man, I want to put some on the shelf, or like, cause like, you know, cause like I said, that's another thing where, to me, that sounds like it might be kind of easy. Whereas like, I know with women, I know it's like a huge, you know, complicated process that like takes long and very expensive and everything.
Right. So yeah, we are very lucky. You literally just, you know, you go see a urologist like me, you say, hey, I want a sperm bank. and then we put you in touch with whatever lab or company we're working with. Like, usually you have sometimes there's labs in the area that you're working around, there's specific labs, and then we give you the paperwork, we talk about it, and yeah, it costs a little bit of money. It varies, but it's not too expensive. Like, it's like you go to the facility, wherever you bank, you provide a sample, they tell you how many vials based off of how much sperm you had or how good your sperm was, and then you bank it, and usually it's like not that much. I think it's like $200 to $300 a month or something. It's not terrible.
Okay, no, that's not bad at all. Yeah, all right. That's another thing. We're like, I don't know how many people are listening or thinking about this stuff, but like, I don't know. It's just it's good to be more knowledgeable about it but guys' windows don't close as fast as women.
That's
so it's
correct.
A little different. So,
well, the thing is with the age, you're right. Like 37 is kind of where for women it's starting to significantly decline. Guys, we know, being in Miami, I saw guys 75 years old,
I bet.
with like 23-year-old, that's just Miami, right? Like, so there is no age, like you can still have it, but we don't have a number, but we do know that, paternity age, like as you get older, there are still higher risks for, genetic stuff, some genetic defects, some autism and stuff like that. There's no real cutoff in age. We just know that the risk increases as you get older. But I'm talking about like starting in like the 50s, not like 35 or something.
Okay.
So it's older, but not.
See, I didn't even know that, but so that's interesting.
Yeah, but I can't give you a number or anything. We just know it's a little increased risk.
Yeah. Okay. And then we talked about cancer checks. Obviously, what do you got to do to feel around your balls?
Yeah, so testicular cancer is actually not that common, but the most common age group is 20 to 40 years old. So if you're 20 to 40 years old, it's about 1 in 250 people get testicular cancer. So it's the most common solid cancer. Like when I say solid, it's like an actual tumor, not like lymphoma or these other ones or like leukemia where it's a blood cancer.
Yeah.
In that age group. And it's pretty easy. I mean, listen, you feel your balls enough. Like when you're in a hot shower, your balls are dangling a little bit looser. Once again, why are they dangling? Because it's hotter and they want to stay away from the hot temperature of your body. So it's regulating your ball temperature. That's why it works.
Wow.
So yeah, there's a cremasteric muscle, and that's why when it's cold, your balls get higher up because they want to get warmer to preserve the fertility of the ball. So like
that's fucking interesting shit.
Yeah, dude. So yeah, when you're in the shower, you kind of feeling loose. Kind of just take your ball, and you put it between your pointer finger and your thumb, and kind of just feel around. If you feel something hard or abnormal, it's kind of like a pebble or something sometimes, and it's painless. It's not painful. It's something to go talk with your doctor about. I'm not saying it's 100% cancer or anything like that. There's a lot of, people have like calcifications and stuff weird around their balls, which is common too. There's other things that people get swollen balls for, something called hydrocele, which is fluid around your balls. You talked about varicocele, where your balls look like a bag of worms, like we said. So there's a couple other things, but I think if you have something that's bothering you, you got to see someone, because a lot of guys sometimes put it off. I can't tell you, there's a couple times I've seen where, I've seen patients who come in through the trauma bay and they said that a piece of wood or something flew from work and hit them in the balls, and their balls were swollen. And you look at an ultrasound, it looks like their shattered testicle. We go in, it's a tumor, because they just never acknowledged that.
Shit.
They were just like, oh yeah, no, now it's this. But it's like, you got to just pay attention to yourself.
Yeah.
And, some guys just won't do that. So,
it's pretty high cure rate too, as well, right?
Very high success rate. Very like in the high 90s.
Yeah. Okay, that's good.
So,
but it's not painful, you said, huh?
It's usually not
typically
painful.
not.
Typically not painful. You don't really get pain with a testicular mass.
Because you do sometimes feel like a twinge here and there, So
oh yeah, we all get that. I don't really know what.
Yeah.
Well, testicular pain is a pretty common thing now. I mean, guys, that's one of the more common things a lot of young guys talk to me about.
Really?
Yeah, and I don't know why, but like there's a lot of reasons for it. And a lot of guys will go see 3 or 4 doctors for their testicular pain before they land on a urologist. So if you're having testicular pain, go talk with a local urologist. There's things we can do. There's, sometimes we make sure you don't have STDs, make sure you don't have a urinary infection of your testicle. We can make sure sometimes like stress and just being very uptight can tighten your pelvic floor and your pelvic muscles, and something like, sounds weird, but pelvic floor therapy can actually help with these kinds of things. So there's a lot of different things we can do for this, but you got to make sure you're talking to the right guys.
Okay. And do you deal with that torsion shit?
Oh, yeah.
If you don't know what that is, that's when your balls like flip and tangle like a Twizzler.
Yeah, so basically you have your spermatic cord, which has the blood supply to your testicle. And some people, sometimes it's like a trauma thing that happens, but some people are just born with this defect where it's a little bit looser. It's usually in younger kids. Like usually you see it like 15, 17 and younger. But, the testicle just twists and the blood gets cut off. And you have that because you are screaming in pain. It's like the worst pain, 10 out of 10 pain. And you got to get to the ER stat. You got about 6 to 8 hours before the testicle dies. So you need
6 to 8 hours. It's like fucking.
It's an emergency. We don't have many emergencies in urology.
No,
that's
shit.
An emergency, and the priapism thing is an emergency because if you have an erection that lasts longer than 4 hours and it stays that long, the longer you go with the erection, the less chances your dick's gonna work when we put.
No
that thing
shit.
down.
So if you really like 4 hours, if you're hard for 4 hours or more, you really should go to the ER.
You should go. And the guys are very embarrassed to do that.
Oh,
they're very embarrassed to do that.
Holy
but
fuck!
I would be more embarrassed if my penis stopped working forever.
Yeah. I mean, it's just take the short-term
both
embarrassment
things are,
for the long-term.
Yeah, those are two of the rare urology emergencies.
No shit,
that
dude.
You gotta do.
What about like I think was it Rodman who had his dick broken?
He broke his dick?
I forget, someone, celebrity or some athlete, I forget who it was. Like, there was like a riding situation and just kind of
You can break your dick. You can break your dick. Like, I've seen broken dicks. And here, what is the position you think is the highest risk?
When the girl's on top.
So, I thought so too. I just reviewed the literature. It looks like doggy style.
Oh, really?
Doggy style. Slips out, you're going hard, and you hear a snap usually. And it's something called the eggplant sign, where your penis legitimately looks like an eggplant. It's black and blue. It's swollen. And you should go to the doctor for that. And you know it's broken because you don't have a bone in your penis. But if you think about your penis as like one of those kiddie balloons, when you blow it up and it expands, that casing of the balloon, if you're pounding and then you miss, that casing snaps like a hot dog casing. Mm-hmm. And then the blood, which your erection is trapped blood, if that casing snaps, the blood now is going out and you can't get an erection again because it's snapped. So you need to go to the doctor. We need to usually surgically repair that. Sometimes you can observe, it depends. But usually for something like that, you got to go to the OR and you got to explore it and you got to fix it.
So is that super bad then, or is it like
most guys can recover okay?
What's the recovery on that?
I mean, you probably have to hold off on sex for at least 6 weeks, 2 months.
Okay.
So
that's better than I thought, to be honest with you, because that sounds catastrophic. That sounds like you're just fucked for 6 months.
Well, I mean, even if it's 6 months, it's better than forever.
Yeah.
And once again, there's other stuff you can do. Other than use your penis to get people off.
Yeah.
Oh, I think that's an important point. Like guys just associate sex with penetrative, man. There's a lot of fun stuff you can do with your mouth and your hands.
Uh-huh. Is there any that's hard. Both of those things are tough to process, tough to digest. Now, we talked about some kind of quirky self-help stuff that didn't work. Is there any things out there that do work actually that is beneficial
for what?
Just towards your balls, towards anything in this kind of depths of discussion?
Yeah, I think the best thing is eating healthy and exercising. I know it sounds dumb, but being overweight decreases your testosterone levels. We talked about the role of testosterone in erections. Having diabetes because you eat like shit can cause erectile dysfunction. There's other things. Some people talk about, supplements and stuff like that. For fertility, supplements are kind of a hot thing. The data has really not been very suggestive of using supplements like multivitamins. Like if you said I want to take a multivitamin, I want to take like a coenzyme Q10 and like vitamin C, I think that's fine. I don't think it's going to hurt you, but there's not really great data showing that these supplements can improve your fertility. But I think it can't hurt. So if patients ever talk to me about those things, I'm like, sure, you can take them if you want. That's fine. And I'm okay with that. In terms of naturally improving your testosterone and stuff like that, there's a lot of stuff out there, especially online, like I think like ashwagandha and all these other herbs. I have no comment on them because I'm not really, there is some data out there. It's mostly not human trials of these things. But I'm just going to say,
you're not comfortable.
I'm not comfortable being like, yeah, this is the cure. Like, it's
it.
not going to cure you. Like, if you're really trying to do the right thing. Oh, another one: tidy whities versus boxer briefs.
Oh, okay. Here we go.
There actually is data that if you want to have better semen parameters, potentially boxer briefs are better than tidy whities.
Really?
Yes.
I always heard that heard boxers were not as good. But I don't know if people wear boxers much anymore.
It's about the boxer briefs, man.
Yeah.
I need more control.
Exactly. But boxers, I remember hearing as a kid, like they're slapping around too much and stuff. There's not enough support where it's bad for your balls.
I don't know about that. I just know that if you think about it from everything we talked about, you're wearing tidy whities, your balls are going up to your belly button, man. It's all the way up there. So, there is one paper that showed that boxer briefs were better. If you really want to just
go into that,
go all in and make sure you're optimizing everything.
Yeah. Well, that's good to know because that's, we talked about like a self-help kind of thing that people thought with the not coming for an extended period of time and you're like, it's bullshit. So I was wondering if there's anything that is people do that you hear about that is good. So
no, you're right. And you bring up a good point because for whatever reason, and this is guys I don't know about you, but every time I get furniture from like IKEA, I'm never reading the directions. I'm going to try it.
Yeah,
I'm going to try. I'm not asking. I'm going to do the thing. If I fuck it up, then I'm going to do it.
It's the worst thing you could do.
It's the worst. So guys, they go online, they go on Instagram, they go on TikTok. They're like, all right, this guy's claiming I could do this thing. I don't got to talk to anyone. I could do it myself. That's guys just wanting to do stuff on their own. And I get that.
Yeah.
I get that. But the thing is, when you're watching this shit online and you're seeing this stuff, it's like, who the hell are you listening to? Who is this? You got to ask yourself, what are the credentials of this person? What are they doing? I mean, we know the content on TikTok and Instagram for all men's health is less than 15% of it is by doctors or medical professionals.
Yeah.
So you're getting information on your dick and your balls from some random dude. If you put it in that perspective, I think you're going to think twice about it.
Dude, the TikTok shit's getting scary.
It's scary.
I got people who are like, no, you're actually learning good stuff on TikTok. It's like, dude, who the fuck are you listening to?
I'm listening to good, if I want to make a good meal, I can do that.
Yeah, exactly.
That's about it,
If you want a tasty video, sure, go for it. But if you're fucking getting some real shit from that, that's
But
scary.
people do because they don't want to go talk to their doctor. They want to try and fix their problems themselves. That's the idea, this masculinity, liver king thing,
They're not fucking going to school till they're 34 and
exactly.
being done like
exactly. You. Just listen to me. I've just been in school for 10 fucking years.
So to be clear, you are certified and everything.
I am a board. I am.
If you were, we covered on the top of the show, but it's a good point to bring up all the time. All right, then we'll leave with two things. I guess my last thing would be, how are you? How do you know if you're going to a good urologist? Is there a telltale sign where it's like, all right, you got a good one? Like if they're dotting the I's, crossing the T's. Is there anything?
That's a really good question. I think that a good urologist honestly makes you feel comfortable. I think is the first thing. That you really feel like you can talk with them about anything. They should be communicating with you well, and I think it's always important. It's like, once again, we talked about doing your own research. It's okay to do your own research in doctors, see which ones you like online. That's okay. And also, referrals. A lot of guys, things like vasectomies, the biggest referral we get is other dudes telling other dudes. So this is something that guys sometimes don't want to talk about with their boys, but sometimes they do talk about it only with their boys. Yeah. And some of these guys have gone to urologists. So you can ask your friends, honestly, sometimes these guys go, and it's kind of surprising sometimes, well, I'm a little biased because everyone I know every single one person's problems, but that's, I think if you ask some people that you know who have had issues that are your friends, they usually have good experiences. And word of mouth is still an important thing. If you look someone up, they usually have some kind of criteria. You can learn about where they did their studying. You can find out. But I think at the end of the day, like, there's so many good doctors out there. And it's just like if you got a connection with them or you don't. Sometimes you don't jive well with one guy or a girl and you don't feel comfortable. That's fine. Go on to the next one. Mm-hmm. But I think it's a comfort level thing, especially when you're talking about these sensitive topics. Gotcha.
All right. That's a good way to say. And then everything with you, where could people find you? I know you have a podcast.
Yeah.
But you are unfortunately moving back to Miami, so you will not be an option for people.
No, I won't.
But hey, we got listeners in Miami for sure. Man. We got people all over the place. So plug away.
Thanks,
Justin.
Man. So you can find me on Instagram and Twitter at Justin Dubin MD. Also on TikTok. I haven't used it yet. I'll start trying to combat some of this bullshit. But so just at Justin Dubin, Dubin MD. I do have a podcast. It's called the Man Up podcast, Man Up, Doctor's Guide to Men's Health. Started about 5 months ago. So we go really in detail with all of these things. And I do it with my co-host, who's also a doctor, male infertility doctor, Kevin Chu. So you can find us on iTunes, Spotify, all the podcasting platforms. The Man Up Pod is our website. I was just confirming that. The TheManuppod.com. And we also have Twitter and Instagram on that. So really appreciate you guys having me on. This was awesome.
Awesome. Yeah. I think a lot of people will get, you definitely got something out of this. I will guarantee if you listen. So Justin, thanks again, man. We appreciate it.
Thanks again, Eddie.
All right. That's it for today, everybody. We will see you all tomorrow.